when I went down to visit my wife at Einstein, I had to wear a mask, you know.
Okay.
And I had to wear rubber gloves.
Okay. So that you do not transmit something to her or someone else in the hospital.
Yeah, yeah. And then the nurse, they would put a big light rubber sheet or something when they were going to do changing or whatever they had to change, you know, or something like that there. But there's always something to
Protect her.
Right.
To protect her.
In other words, the fear of me getting something from her, but also me giving her something, come in there yeah.
And that's actually probably what they were protecting her from her, because her immune system was weakened already. She was sick, she has Alzheimer's, so she already has a weakened immune system.
But after well, the first day, well, she was really, I mean, when they come with the ambulance, she was like, I thought, oh my God, something's wrong. I didn't even think of flu. But she just lost a week and everything. And I slept on the couch downstairs because I didn't want to go upstairs because she couldn't even walk, like, you know.
And those are the symptoms.
And, you know, you start thinking the worst.
Those are the symptoms.
She snapped out of it after, in there one day, she's in there singing. La, 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 la.
And those are the symptoms. The symptoms usually are you extremely tired, your muscles ache, coughing, you get a high fever. It's usually
she had a little bit of a fever. She had a little bit of a fever.
Okay.
Right. And she coughed, but it was a dry cough.
Okay.
And she didn't have a lot of mucus or anything.
Just a dry cough, okay.
And so that there were the signs, but then she just started getting worse.
Okay.
You know, as it moved along.
As it moved along.
Now, are there side effects? There are side effects. I guess every medicine that you take, you'll see side effects, even the aspirin, you know. So there are side effects.
And usually from the flu side, I hear people say that they get a sore arm at the area of injection, or the muscle may feel sore for a couple days. They may even get a mild fever.
Just a little
usually
something.
Just a little something to let you know I got a shot. Usually the irritation in the area. And that right there may last. It usually happens right after, within minutes or hour after getting the shot, and may go away within a day or two.
Yeah. So that's no.
But
now,
if they get a severe reaction,
I don't want to repeat this, but I got a shot last year, and then you think I could get another one? Is it a problem if I double up within 6 months or so, or what?
There's no need to. Just one shot annually.
Annually.
One shot yearly.
Okay. All right. Okay.
You don't need to double up. Right. You're not going to get more protection by getting another shot.
And the symptoms, they would last not too long, I don't think, whatever.
The symptoms of?
The flu shot.
No, usually a day or two and they disappear.
Yeah. All right, now, if I come down with the flu, right? What should I do?
Stay home.
Stay home.
Stay home.
And watch
avoid
the Cisco show.
Avoid contact with any other people if you can. Limit your contact. Call your doctor to make your doctor know what you're feeling, your symptoms or what have you. Yeah. And then he will direct you if you need to be in the hospital or come see him.
Fluids, wash it away.
Increase your fluids. Yes, rest.
Rest, no exercise or so, a little bit. Little legs won't hurt anything. A little bit.
You'd probably be too down and out to exercise.
You're right. You got that right. You're right. Yeah, because
if it's a true flu,
you're tired and everything.
Yes,
you don't
your
feel like
muscles
exercising.
Ache. Yes.
So you're gonna rest when you start. Feeling
and
good.
And actually make your doctor aware, because then he would be the one to know if you would have to have medication, which there is an antiviral medication for if you truly have the flu.
Oh, okay. And then, if like I say, if I come down with the flu, the most important thing is stay home, rest, fluid, take the medicine, right?
Right, if your doctor has given you medicine.
Okay. You want to hook that on there? Just hook it on. Clip it on there on your shirt. That's it. Good. No problem. That's it, right? I think it's going the other way.
It's going the other way?
Turn it the other way. That's it, so the mic is facing you. Give it a clip.
Got it.
That's it.
I got it.
All right,
okay.
now. Okay. Where are you from? Tell me something about you.
Well, I was born in Augusta, Georgia.
Hey, I was in the Station of Land of Georgia. Okay.
I moved to Philadelphia, I guess I was about 2 years old. Grew up and raised in Philly. Moved to Montgomery County, then moved back to Philly. So when I got into nursing, I guess as a young woman.
Yeah. And how about your training? What kind of training you get?
Training. I went to LPN school, okay, which is for licensed practical nurses. And I worked in several hospitals. I've worked in even some long-term care facilities. But
yeah,
most of my training have been in hospitals.
Yeah.
And then I lucked up and got a job with the health department when I felt as though I didn't want to do hospital work anymore.
Oh, yeah?
Yes.
Well, that's, so your job now, what do you do? What did you do?
Public health nurse, I do a wide range of everything. I'm a generalist, which means that I am with the immunization program, which provides immunizations to children as well as adults. So, of course, flu is one of immunizations that we're generalized in. I also work with TB patients, giving TB medications to those who have tuberculosis, if you're not familiar with TB. And then we also have other various clinics, sexual transmitted disease clinics.
Right now, this radio, TV, newspaper, has anyone died? It's unusual here in Montgomery County. How many cases, approximate cases, do you have in Montgomery County? We can say, hey, we do have a problem. Is it worse this year than any other year, or
Actually, at this point in time, the numbers are increasing.
Increasing.
We've had 900.
Because it came early, maybe.
Yes.
Right?
Yes.
And it's going to stick around.
I believe so. We've had 900 plus cases, confirmed cases.
900.
900 plus confirmed cases in Montgomery County. 4 flu-related deaths, which means flu helped contribute to their deaths.
Oh.
Yes. And I'm sure the numbers, hopefully the numbers won't climb.
Hopefully, right.
Hopefully they won't climb.
We know that, you take, you take like in some of these here nursing homes or facilities where suddenly one gets sick and then they quarantine the whole outfit, right?
And which is needed
you
to
worked
do.
I
worked in a long-term care facility, and
what do they do with what do you do with a case like that? No visitors, nobody can come in.
Because
they don't go into the cafeteria.
Right.
They eat in their room.
And number one, they're actually protecting any of the other residents that live there from contracting it, because if someone brought it in there, most of the time, most long-term care facilities always vaccinate the residents. They always give flu shots to the residents. But what they don't always recommend or do is those that work there.
Oh.
Those that work there may not be mandatory that they get a flu shot. So they could be bringing it in, or visitors could be bringing it in.
Right, right. Well, and I think sometimes they give people a mask to wear the mask. I don't know if that...
Right, but most of the time when it's in their facility, if they have a great deal of residents and they have an outbreak in their facility where flu is pretty big, then usually they'll quarantine and stop visiting for a minute or two until they get it.
Now, if someone goes to the hospital, like my wife, I guess she's one of your numbers there for the health department, they have to report them numbers or cases to the health department, and they keep track of it, right?
Yes, it's usually reported to the state, and then the state in turn will report it to the health department in that area, meaning if the resident lives in, or the person who came to the hospital is in Bucks County or lives in Bucks County, they'll report it to the Bucks County Health.
Oh.
If they live in Montgomery County, they will report it to Montgomery County, right.
I know, I think it's last year or the year before, I had Mike Basinger.
Yes.
He's one that's involved too,
Yes.
So when I said to Dr. Domino, I said, well, he says, Basinger, whoever it is, I says, I want someone down there at my studio. I don't care if it makes sure she knows something, he or she knows something about the flu.
Okay.
So they, you came.
So they sent me.
And you're doing a good job.
Well,
you're answering all these questions.
Thank you. Thank you.
I'm going to give you A.
Thank you.
Teacher.
Thank you.
But now, we want people to be